Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Senese. Nice to have you on board. We come to you live every Saturday at 10:30 a.m. Central Time. We come to you on YouTube, Facebook Live, and on X, so you can catch us any of those times. If this is your first time visiting us, be sure to check out our website at UroPatient.com. You'll find lots of helpful information, plus links to the live shows and all of our past shows. We've got a bunch of them there for you. So be sure to check out that UroPatient.com website. Also, we have this group of helpful handouts, and I put together a bunch of those too. So almost everything you could probably think about is there. So look for that helpful handout. I think a lot of patients like to download these and take them with them to their doctor's offices. It kind of helps make sure you ask the right questions, etc. So anyway, be sure to check out our website. Now, we got a great episode for you today. I was thinking about some of the things that I wanted to talk about, and one of the biggest issues that I think people have is dealing with having a Foley catheter, a urinary catheter, those tubes that are in your bladder. We talked about them. I've talked about how to remove them and stuff like that. But, you know, the bottom line is this thing right here. You've got that bag on your leg, this tube that's going inside you, and that's where your urine's draining into. So you're wearing your urine on your leg, not really the natural way. Well, there is another option, and I'm going to talk to you about that other option today. So what is the other option? Well, it's something called a catheter plug. You might say, well, what the heck's a catheter plug? Well, we're going to talk about that. But anyway, we're going to explore the use of catheter plugs with Foley catheters, another option. I can tell you that in my years of practice, I've had many patients that have used these and are really, really happy with them. And I was at a recent lecture where somebody talked about some other benefits of using that over the bag. Anyway, we'll cover when to use them, how they work, associated risks, kind of best practices. So let's start with our goals. By the end of this presentation, you should be able to define what a catheter plug is, understand when and how to use them, and identify safety measures to prevent complications. That's what I'm here for. So again, what is a catheter plug? If you've never seen one or heard of one, maybe something foreign to you, they're easy to get. I'll tell you a little bit about that in a minute. But a catheter plug is a small device used to seal the end of the Foley catheter. It allows urine to collect in the bladder. Sometimes they do this for certain diagnostic procedures, but it can also be used as a way of maintaining your urine rather than wearing it on your leg. Let your bladder store it like it did in the old days. So plugs are particularly helpful in maintaining a normal bladder function. And this is what I learned about at this conference, is that, you know, there's a need or a use to why our bladders fill and empty. It's kind of a good way for the bladder to clean itself out. So when you have a catheter draining it all the time, it's never really filling. So you don't have that therapeutic flush. And that can help to clear out things like mucus and debris in the bladder. That may even prevent some infections or decrease the risk. Can't be used on everybody. There are contraindications. It's not for patients that have an active urinary tract infection. You don't want to be blocking off of infection with a catheter. Now, anybody who has a catheter in for a length of time is going to have kind of what we call a friendly infection. So I'm talking symptomatic urinary tract infection, especially if you have something like a fever. You're not able to use it for that. You need to keep the bladder draining. Now, there are one other case where people that have had spinal cord injury, and sometimes the overdistension of the bladder can cause something called dysreflexia, which is a very dangerous situation where your blood pressure can go way up super high and stuff like that. So if you're spinal cord injured, make sure that you're not using that. Always check with your doctor to see if you're a good candidate for this. So there are different styles of plugs. Some are just a simple stopper and you take it out to drain it and put it back in. Others include a drainage port for periodic emptying, like you see on the bottom. So the top are those simple in and out corks, and the bottom have these little valves that you can turn on and off to empty it. I think those are pretty cool. Pluses and minuses, the ones on the top are really small. They don't really kind of take up any room, where the other ones have a little more bulk to them. So you'll kind of figure out which is best, but the one doesn't require that you take it out. I mean, you just open it and drain it, which is pretty neat. And what equipment do you need? You don't need a whole lot. Clean hands. If you're doing this at home, you know, we wear gloves in the office to protect us against germs from other patients, but really for your own germs. Good hand washing is all you need. A catheter plug, of course. And we usually recommend something like an alcohol swab to wipe off the end of the catheter, wipe off the catheter plug before you use it. But the procedure is super simple, and we're going to talk about that for you right now. We're going to go into that. So let's go ahead and bring up my other film here, or get my other screen so I can talk to you about that. So remember, this is where we're going to start with. We got that leg bag, this bag sitting on your leg full of urine. Yuck. So here's the other option, is something called a catheter plug. Very simple device. So this device can be plugged. So what we can do is you disconnect your catheter, don't need that bag anymore, and you've got your catheter ready. And all you do is insert this plug right in there, and that's what you wear. Let your bladder fill up normally, and then let's talk about the removal procedure. So again, the removal procedure is probably just as easy as the placing it, but I want to give you the full picture here. So removal, a little twist turn. Now again, remember, we're washing our hands first, okay? A little twist turn, you pull this out, and for men, you can just let this part hang out your zipper, and just like you're taking a leak, just let that drain right into the toilet. Once it stops draining, you want to, like I said, if you have an alcohol swab, that's ideal. Just kind of clean off your plug, clean off this area here, and just go ahead and put that back in, and you're done. Couldn't be simpler. I mean, it's a shame. It sounds so simple. Now, that other one that has a little valve, you don't even take this thing off. You just flip open that valve, just sort of like what's on the bottom of our catheter bag. This one doesn't have quite the same valve, but if you had one like this where it's a twist, so it would be similar to that. So you have this little valve you can just open. You don't have to worry about playing with this thing. Now, one of the things I have to say is you may be able to go by the feeling that your bladder feels full, so you empty it. But I always say it's best to kind of go by the clock. Make sure that you're checking and you're emptying it on a pretty regular basis. I'd say about at least every 4 to 6 hours. Now, of course, if you're drinking more fluid, you're going to have to empty it sooner. But if you were to experience any pain, discomfort, or leakage, then definitely empty it sooner. And again, things like fevers, stuff like that, you're going to not be able to use this. So you're going to want to have the bag available to switch over. Now, all interventions have risk. One of the primary concerns, again, is UTIs due to prolonged urinary retention and bacterial growth. Everybody who has a catheter is going to get a urinary tract infection. We say most of the time they're what we call friendly bacteria, so you don't have to really worry about them. But if you were to get a febrile or symptomatic, we call it, then you need to talk to your doctor and find out what should be done. So you'd want to make sure that you're not leaving that plug in too long, too. Those are issues that can be a problem. And I talked to you a little bit about that dysreflexia. If you had spinal cord injuries, that can be a dangerous situation. But otherwise, this thing is really, really simple to use. And I'm going to talk about some of the benefits that it provides. One of those is comfort and mobility. So no leg bag. You don't have to worry about, that stinky, smelly leg bag that sometimes you notice when you're wearing one. Gone. You don't have to worry about that. Easier to wear normal clothing because you don't have that bag hanging there. And if the bag were to leak or something, you got that urine that could spill on somebody's, maybe you're sitting on somebody's couch. Sure, this could fall out. Anything is possible, but it's pretty well in there. Most comfortable for short-term catheter users and those transitioning off of a catheter. Better body better body image and privacy. Again, this is much more discreet than a visible bag. And I think for most patients, psychologically, it has a lot of good benefit for it too. Now, this was one that I hadn't mentioned, but I think that this is a biggie too, it's more physiological. Remember what your bladder does for a living: fills up with urine, empties urine. Now, when you start draining it constantly, that doesn't happen. So I think that this promotes better normal bladder function, and it can reduce some risk of some complications. One of the things I didn't mention is, let's see, I'm going to go back over to my full screen here. So one of the things that I failed to mention is, now most of these catheter bags, because the way I had this one hooked up, let me just kind of show you again. So this is the catheter bag. This is how this one was hooked up. Now, most of them are not hooked up that way. Most of them have what's called extension tubing, so that you can get some distance from where it's coming out of you to your leg, and it doesn't pull. I don't put any on without extension tubing. So that extension tubing can be a source of trapping urine that could be infected. Now, the bag itself, right in here, is a one-way valve that keeps urine from flowing in the wrong direction. However, from the catheter to this bag, that other tubing has no one-way valve. There's no one-way valve in a catheter. So the big advantage of the plug is you don't have that storage of urine in that outside tubing. You just have what's coming out of you. That's not very much to have to worry about. So I think that's a big plus. So, and finally, it's just easier for some patients to manage. This is just easier without having to deal with those bags. Simple for the people that have to take care of patients and help them out. So there you have it. That's, I think, about everything I could tell you about a little catheter plug. But, one thing I did mention is you can get these probably from your doctor's office. I actually ran out of these in my office, and I was going to get one for today's demonstration, and I didn't have any. So I actually went on Amazon and bought this one. It came overnight, and it was, I think, $4. I always recommend don't have just one. Make sure you got a couple of these because, boy, it's easy enough to lose something that small. So make sure you got a couple. But, again, imagine this is like almost outside of having a catheter in, which you're not going to have it in because you want one. It's because you have a problem. This is almost like being back to normal. Just take this thing out, pop out the cork, empty it into the bathroom, and recork it. You're good to go. So I hope you found that helpful. Keep tuning into the UroPatient podcast, where you can get more and more great information from us. Always glad to share everything we know about urology and all my experience. I can tell you I had several patients that have used these, and they are never complaining about it, saying that it wasn't a good idea. They're glad they switched over. A lot of patients worry about it at night, and they do wear the bag at night, but when they're about the day, moving around, going around, that plug works. All righty. Have a great rest of your day.